Good morning, everyone, and welcome to this morning's webinar, Leadership in Nursing, presented by Cheyanne Culbert. Through this week, it's Nursing Week, so we've been recognizing all of our nursing professionals and what they do every day. Today, specifically, is LPN Day, so we'd like to give some extra recognition to our members and the dedication you show each and every day. The contribution you make, whether you're in New Brunswick or you're in another province, is so important and so valued. So we thank you for all that you do. So as I mentioned, Cheyanne Culbert will be presenting today's webinar. So as a registered nurse for 20 years, Cheyanne has incorporated professionalism and exemplary standards into her career, spanning acute care, long-term care, teaching nursing students, research coordination, and senior nursing leadership positions. She is the founder and CEO of Beacon Clinical Group, a healthcare education and consulting group. As an advanced practice nurse with a master's degree in nursing education, Cheyanne was recognized in 2021 on an international level as a fellow in person-centered care by Planetary International. So she's bringing lots of skills to the table here, lots of interesting stuff. So welcome, Cheyanne.
Thank you so much. I really appreciate it. And happy Nurses Week to everybody. I think it's an exciting week just to recognize the awesome work that you do every day. And just want to say thank you to the association for recording this. Just want to give a shout out to the people who are watching this at a later date because you're at work, you worked a night shift and you're asleep. We all just kind of come together, the world of nursing, and so love that things are being recorded for people to catch up later. So see if I can get my slides advancing here. Sorry about that. So I did actually two sessions this week. So today you're here for Leadership in Nursing, and there is a pre-recorded one from earlier in the week on workplace civility. So just if you want to go back and look at that one, you feel free to go ahead. So when we think about leadership in nursing practice, it can bring up lots of different thoughts and our ideas. It kind of can span a variety of aspects, but a good place to start, because it's a big topic, people do whole degrees in leadership, but a good place to start, I thought, was in our entry-level competencies for LPNs. So these are 67 competencies that we would all have, or you would all have as LPNs when you're coming out of your program. So I just highlighted a couple of them here, because sometimes we can think in our roles, no matter what, well, I don't really have leadership as part of my role. I don't hold a formal leadership position. I'm not a director of nursing. I'm not a shift supervisor. But actually, all of us have an element of leadership in our daily practice. So these are ones I just pulled out. So, and again, these are the entry level of practice. So these are the things where they are assessing you on when you're going through nursing school and when you write your national exam. So you're called as LPNs to recognize, respond, and report questionable orders, actions, or decisions made by others. That's an element of leadership. We're to promote effective interpersonal interaction. We're to use conflict resolution strategies to promote healthy relationships and optimal client outcomes. That requires leadership. We have to demonstrate leadership, direction, and supervision to unregulated healthcare workers and others. We're participating in creating and maintaining a quality practice environment that is healthy, respectful, and psychologically safe. Sometimes our obligation in that involves some elements of leadership. Just moving my little slides around. Sorry about that, everybody. So we have a responsibility to initiate and foster mentoring relationships, to think about group dynamics and group processes and that whole interprofessional team collaboration. We're to demonstrate both formal and informal leadership in our practice. And we have an obligation to organize our workload, assign and coordinate care, set priorities, and demonstrate effective time management. Okay, so those are all in our entry-level practice, our competencies. And oftentimes I'll hear when I'm out and about across Canada in long-term care homes, people talking about a change in my scope of practice. Or, I'm really being called to do things differently now. And before I didn't have to do this, but now my employer is expecting this. So I just want to take a minute just to share a graphic, and this comes from AMBLPN's scope of practice, and I put links on all these so you could get to the document. But just want to remind people that of those 3 layers. So there is our whole professional scope of practice. So this is the level that we were educated to when we went to college, and we graduated and we're ready, and we are licensed and we're starting to work. And within that is kind of our own individual comfort scope of practice. So I'm going to give an example of that. So my professional scope of practice may involve blood draws, phlebotomy. But in my individual scope of practice, I might have worked in an organization where there was, or I just might not have had a lot of experience in doing it, right? And then there's also another factor, which is scope of employment. Okay, and so when we think of that, it might be that you've worked in a facility where that wasn't expected of you. Okay, and so what really has changed over time is not our scope of practice or for you as LPNs, but it's almost that scope of employment, and employers are realizing that you have so many great skill sets and challenging you to work to full scope of practice. Okay, and some of that is those clinical skills we talked about, like phlebotomy and IVs and things like that, but some of it's not just the tangible skills, it's those leadership elements too. And that's left some of us feeling kind of challenged. So that's really what I'm going to look at today. Just talking through that research and trying to build out some of those skills and get you thinking that way. So hopefully that makes sense to you all. And I will say that we will open it up to questions at the end. So the questions will be submitted via the chat. And then I'll respond at that time, and hopefully we'll get to them all. And if not, we'll do some follow-up afterwards. So just continuing to move along. So in the research, and when you go out and talk about this, there's really kind of 2 different bodies of literature, but there's also, for us in our minds, we might have divided them too. So there are those among us who will have former leadership roles. So I've had one of those before. I've been a director of nursing. That is a formal title. But there's also an element that we need to look at, which is just our leadership at point of care. Okay, so that's in our bedside nursing, in our frontline care, in our dealing with our peers. So what I'm going to talk about today is applicable really to both of those elements. But I just want to make mention that even if we're not in a formal leadership role, we are being expected to live out some of those qualities. And the only reason why I'm laughing is because I'm thinking some of my colleagues who sometimes will say, well, like that's why that person makes more, that's why whatever. And the challenge is that there is a basic element that we're all called to in our entry level of practice. So here's just a really great quote that came out of one of the reports that I read. So nurses providing leadership at the point of care are a critical part of the future of patient care, and organizations committed to providing high quality patient care say the most significant contribution for leaders today is the development of leadership skills of others to support them to prosper and grow. So my passion is around leadership. My particular company does a lot of leadership education around long-term care. And so it is really a growing and evolving field. So there was a great kind of study or article that was released by the Chicago School of Nursing in 2021, so really recently. And they highlighted particularly in nursing, there were 5 leadership skills that if you could develop those, they were very effective in the workplace. Okay, so there's tons of skills in leadership, but what I liked about this particular article was just it narrowed it down to 5. So then that feels kind of, okay, what are people looking for? What do I need to be doing? So the first is decision making, and we'll talk through that. So what we need to really lead in is the ability to make logical decisions, but also to make them quickly. We need to provide guidance to others, okay, whether that's on a technical skill or dealing with other challenges. We need to have skills in conflict resolution. We also need to be effective communicators, and we need to be able to go with the flow with change. So those skills of change management and adaptability. Okay, so if we can harness those 5 leadership skills, that'll really serve us well in our nursing career, whether we're in a formal leadership role or we're doing that leadership at the point of care or leadership at bedside. So that's the focus of today. I mean, I'm thinking about what can I cover in a half-hour webinar. So we're just going to narrow down into those skills. So the first one I wanted to talk about is just the whole concept of ethical decision-making. Certainly the pandemic has challenged us in ways, and lots of things happening. That we've really had a lot of growth in this over the last 3 years. But when we're thinking about building our ethical decision-making, I just want to give a nod to the Code of Ethics for LPNs. That is there for you. It's certainly a resource. I know that your association is open to calls to talk about practice and things like that. So just wanting to refer to that document for you. The next is when we're thinking through this code of ethics, and we're thinking through any challenge, from the regulatory perspective, they're thinking of 5 ethical principles. So what's my responsibility to the public? What's my responsibility to clients, to my profession, to my colleagues, and to myself? Okay, so that's a logical process that we can work through as we're working through these ethical decisions that'll come up. So whenever we have them, we should think of all 5 of those elements. Okay. I just want to say that in the back of this document in Appendix A, there's a really good guideline for ethical decision making. So if you're ever in quite an ethical challenge and you actually have the time to sit down and write this out, you know, you're not making a moment-to-moment decision, say in a code or something else. But there is a really great process that was there and some guiding questions. So I encourage you to go through that. In terms of kind of in a moment-to-moment thought, I have a really great mentor who has taught me a lot over the years. And she actually does some teaching now for my company. And she teaches a course on ethical decision-making. And she always uses these things. So she'll say, Cheyanne, you know, because sometimes I'm coming to her, it's just someone I go to when I have challenges. She'll go, is it legal? Is it honest and fair? Is it in our interest from the organization to be doing this? How does this decision make you feel about yourself and the organization? And would you feel comfortable if an account of your actions were published in the paper? And so that's just another way to be thinking it through when we're thinking of all these different things. And I know more and more things are, you know, going into the media. So just love that she adds that element for me. So I'll give her full credit. Her name's Cindy Donovan from Loch Lomond Villa. She's a CEO. And so those are Cindy's questions that she always goes through when she's working through a challenge. She's a registered nurse. So the next section or the next area that we really need to build in our leadership is our ability to communicate. And communication is more than just talking. It's an information exchange. So it's happening all the time. Even walking in a room and not talking, that's communicating something. I know with my children, I have certain looks that I give and it communicates a whole message. But it's so deep in there's so many cultural principles of which we are mostly unaware that are happening with communication. So just really wanting to draw your attention to that, to be thoughtful about your communication strategies. And I found this statistic, which was really quite mind-blowing. So in any interaction that we're having with our coworkers, with our patients, with our senior leadership management, even with our family, we are being judged 55% on how we look. So not just, you know, how good is Cheyanne's hair today, but everything, all my expressions, those things. 38% on how we sound, and only 7% on what we say. Okay, so sometimes we can think a lot about what we're going to say before we go into a room, but it's also really helpful just to take a minute to collect yourself, to think about the tone that we're going to use, and to think about how are we presenting it. So are we standing over someone as we're talking, or are we sitting down at their level, the tone of voice that we're using, and all those different things. And I really recognize that this is a challenge for everyone. I'm appreciative that you all work in busy environments, and to take that moment to pull yourself together sometimes is hard before an interaction, but it really will serve you well. And that is really where I think us as nurses shine when we take that time and do that, because we can really make a patient or a coworker feel at ease. So just wanted to share that little tidbit with you. And then just thinking about what are the potential barriers to communication. So this is a graphic that's there that details all kinds of different barriers that can be there, but there's actual environmental barriers. And the biggest one I can think of that we've lived with for 3 years is masks. When people can't see our facial expressions, they can't see our lips. Sometimes we're in noisy environments or working in an ER where there's only just like, you know, a curtain separating us from the next patient and all those things. Barriers caused by their wrong choice of medium. So, you know, someone's getting a message one way and really they'd like to be getting it a different way. Semantic barriers. So we're great at using medical terminology and different things like that. And sometimes there's, you know, a different meaning to those words. There could be cultural barriers in terms of different diversity of cultures. So what's acceptable in one culture could be not acceptable in another. Again, there could be psychological or attitudinal barriers. So it can just be sort of moods, attitudes, and relationships. So I know sometimes I might be charged to go in to provide education to a family. And when I walk into the room, you can cut the tension with a knife. There's obviously some relationship or attitude issues that are going on there. And sometimes that really is a barrier to what I'm going to be able to communicate to them. This last one always makes me laugh a little bit, but it's barriers caused by varying perceptions of reality. So really, it can be caused in terms of people's different levels of understanding or comprehension. And this one, when I think about it, I think about all my coworkers and just times when they're just, you know, they're working short, they're doing the best they can. And sometimes they feel that a patient or a patient's family just don't understand the current context that they're in. And so varying perceptions of the reality, right? And so they're coming from an advocacy portion and advocating for their loved one or themselves. And we're coming from a perspective of we're really, you know, we have a heavy workload. Okay, so all of those things can be barriers to communication. And I'm not saying that you need to eliminate all of them because some of them are not within our control, but some might be. And sometimes a little bit of work ahead of time can really lay a foundation that we're able to deliver messages more clearly. The next little element I'm going to think about, or I challenge you to think about in terms of communication and delivering messages, is how do people receive information in a crisis? Okay, so there was a researcher, Vincent Cobello, and he, in his research, found that if we think that we are at risk, so if we perceive ourselves as being at risk in any way, shape, or form, we only process 20% of what we normally would. So 80% of that is gone. Okay, so I mean, everybody has their normal baseline of how they process information, and that varies again, and because of those things. But anytime we think we are at risk, that goes down 80%. Okay, so sometimes in our workplaces we can feel at risk. Sometimes our clients feel at risk. So what Vincent Cobello shared is that during these times of crisis or when people feel at risk, we really need to change the way we communicate. So he recommends in a crisis or an emergency, we should never have any more than 3 key messages. Okay, we need to keep repeating those key messages frequently. Ideally, we can reinforce that with verbal and written communication with visuals. Okay, so we're saying it to people, but we also have it written down. Okay, and there's visuals there that are reinforcing it. We really need in these times to keep it simple and have no technical terms. Okay, so times that you may need to use this is maybe there's a crisis happening in your unit and you're providing direction to others. There might be a crisis happening with a family. So just really encourage you that in those times of crisis, if people really think they're at risk, slow yourself down. No more than 3 messages. Keep repeating those 3 messages. Maybe have those 3 messages in writing as well, and keep it simple. Okay. So just an example of how we have to adapt in our roles in healthcare. Next little section that I'm highlighting, and again, these are just golden nuggets taken out of things. So we're going to dive into conflict resolution strategies, and just want to say too that the AMBLPN website is a plethora of resources for you to go out and look at. And so if you're getting into this and think you want to know more, they're there. There's a resource there for you. There's lots of external educators, myself being one included, that provide courses in this, certifications in this, all these different things. Okay, so this is just enough to kind of get you going. So these are 5 conflict resolution strategies I'm going to go through that can really help you try to resolve disagreements quickly and effectively. So we've all been in situations where there's conflict, and some of them have really dragged on, right? And so trying to employ these conflict resolution strategies is helpful for moving it through more quickly. So the first thing in managing a conflict is to raise the issue early. Okay, so anytime you perceive there's a conflict happening, or there's something that could be a conflict, the sooner we start talking about it and raising the issue, the sooner it's going to be handled quickly and effectively. Okay, the larger a problem becomes, the more challenging it is to address it. The second strategy is to really manage your emotions through that as best you can. And we talked about some of this in my webinar on Wednesday about workplace civility. The next is it's key to show empathy, even if we disagree with others, but to show empathy for them, to really practice active listening. So we're not listening to respond to them. We're not coming up with our whole answer the whole time they're talking. We're actively listening, and sometimes that even means echoing back what we've heard. And certainly in that as well is we need to take some time to acknowledge any criticism. Okay, so when we think about conflicts that are happening in our workplaces, maybe with our peers or anything else, if we can employ these 5 strategies, we'll be more likely to have success as we work through those conflicts. The next thing I want to talk about is something called crucial conversations. So yes, there's ongoing conflict here and there, back and forth, but sometimes we get to a point where we just really need to have a crucial conversation with someone. So there's books about this, about crucial conversations. There's websites if you look it up. But basically, in order for it to qualify as a crucial conversation, that means that the stakes are high, the opinions vary, and emotions are running strong. Okay, so that little trifecta makes something a crucial conversation. They usually happen when we deeply care about what's being discussed, or we deeply care about the people who are being discussed. They're really hard conversations to have because we're thinking about the real fears or perceived fears that might come from the consequence. The main thing I want to talk about is if you get in one of those situations, is to really make sure that we're taking the time to think through what we're going to talk about, maybe leaning into some of those resources that I talked about crucial conversations. But just know if you've reached a pinnacle where something has come to a head, it has to be addressed. A key finding from this research is that if we don't talk it out, we will act it out. Okay, so if it is not addressed by being talked, it's going to be there in an action. So sometimes we just really want to bury our head in the sand and not deal with something. And just know if we're not dealing with it verbally, it's not necessarily going away. It's going to be acted out in actions. Okay, so just really encouraging you to have that moral courage to come forward and have those crucial conversations. The next skill I'm going to talk about in terms of building our leadership, and I know this seems like a lot that I'm throwing at you, but is that whole idea of adaptive thinking. So that's a critical skill that we need to develop. And so what is adaptive thinking? So it's being able to recognize unexpected situations. So I'm walking into a room and I'm removing a catheter, but when something goes differently, just that quick ability to recognize that there's something unexpected happening. The next is as I'm going into actions, just thinking about all possible responses. Okay, so what can happen as I'm doing this procedure? What are the possible ways this could go wrong? And then the ability to decide on the best response. The best action is critical as well. Okay, so being able to quickly recognize that something's going different, considering what are all my possible responses and actions to that, and being able to quickly decide what's the best one. So that's going to sound a lot like critical thinking. You're going to think, oh, well, I learned that in school. I learned how to critically think and make that decision. But I found this great quote that really exemplifies it well. So it says, if critical thinking is the ability to be exceptionally rational, then adaptive thinking is the same ability to be rational and logical, but doing it at a high speed. Okay, so that we're able to be quickly doing those. So that's what I'm talking about in terms of adaptive thinking. So Cheyanne, how do I build these adaptive thinking skills? You know, I end up in these crises and I need to make these quick decisions. So how can I do that? So again, we're not going to be able to apply all of these in every situation, but I encourage you to be working on this proactively. So the first is anytime there's ability for advanced planning and preparation, that's always helpful. I work with a few care homes that have built in their monthly staff meetings or quarterly staff meetings, just working through scenarios together, things like that. Anytime we can work through ahead of time a scenario, gain experience from others, that's very, very helpful. The second thing I can do when I'm building my adaptive skills is work to understand the complexity of the problem. Okay, so what's happening? So there's always that surface layer, those symptoms that are right at you, but just making sure just when I'm thinking the whole problem through, or am I understanding all the dynamics of it? The third thing would be, in any situation, work on considering all possible outcomes that can happen here. The next thing would be, and this is a deep skill, learning to stay calm under pressure. Okay, and that looks different for everybody. And for some people, that's really natural. And for others, that's a challenge. So that is a key one. And most of us would work in workplaces that have an EFAP program, an employee family assistance program. And so sometimes there's resources there in that, in being able to help us do it. I actually years ago was taught by a physician to do like biofeedback. It's a certain breathing technique that kind of regulates out your heart rate. I use that in different strategies sometimes, just taking some deep breaths to settle myself. The next thing is just even any chance we get to participate in a simulation exercise, that's really helpful for preparing us to build that adaptive thinking. And I know for some of us, if we hear simulation exercise, we groan, but they really have evolved and advanced over time, and it is very helpful. The next thing is a really personal decision, but you can build your adaptive thinking skills by being more open to new ways of doing things. Some of us are really kind of set in our ways of the ways that we traditionally do things, and we prefer to keep it that way. That's more challenging. You're not using as adaptive thinking. So being open is one way. And then anytime we can do a practice in a non-critical moment is great. It really can help us build our confidence and our skills that way. So just looping back, I guess one of my slides wasn't in there that I wanted to do, but I just wanted to loop back. Sorry that this is going fast. To talk about this, getting back to those 5 effective leadership skills in nursing. So again, just looping back to let you know that we all have, an element of leadership in our jobs, whether we're, it's at point of care, bedside, or in a formal leadership role. But these are 5 skills that if we really work on to develop, they can really help us. And these aren't the one and done things. These are the things that we consistently practice over time. Okay, so as we're practicing our decision making, giving others guidance, being able to resolve conflict, communicating better, change management and adaptability, so that adaptive thinking, all those things help us build towards it. So just like if I decided that I wanted to have really defined biceps, I couldn't just go to the gym once and do a couple of things and be done, and then yay, I'm fit and I've done this. Leadership skills are the same. They're things we need to practice over time. We need to do so many repetitions and keep doing them to keep up with those skills. So just really encouraging you to do that. Don't be discouraged if you try it once and it's not working so well. Just keep going. It's something that does need practice. And something that is really rewarding when you build those skills. You'll find that your workload is more manageable and you're more able to just more able to deal with the challenges that are with you day to day. another fast one here, just to close out before we get to questions. Just to reiterate again, please feel free to reach out if you have any questions or you're looking for additional supports. I'm happy to send you different web links and different things that way. Feel free to check out our website, Beacon Clinical Group. It's actually unfortunate, but it's undergoing a revision, so it wasn't active this week for Nurses Week, but it'll be active next week. Feel free to reach out, and then again, as always, reach out to your association. They certainly are there for you. They are a very responsive organization, so just very grateful for those. But I really just want to thank everybody for your time, and again acknowledge that it's Nurses Week. So happy that I was asked to be here with you to do 2 webinars. And thank you so much for choosing nursing.